Georgie, thanks very much for your time. Let's just ask, first of all, what are your thoughts on the lockdown? From the numbers we've seen so far, do you think there's justification for going into a second week?
Well, Tom, as you point out, last year's second wave and the extensive lockdown that Victorians had to endure, and the sad case numbers of Victorians that died, over 800 deaths, and the destruction that had occurred across our economy is still being felt. We're the only state that's had 4 lockdowns. And what I think is really concerning for every Victorian is they want to know, is the government planning to extend this current lockdown further? Because there is still so much uncertainty and confusion out there. Despite the numbers that you've just described, Victorians deserve to understand exactly what the government has planned. And to date, we are just not getting that information. And I think there is a huge amount of anxiety and a huge amount of frustration and despair amongst the Victorian community at the moment.
It is pretty easy, though, to see where this is all heading, and that is where other states have headed towards something akin to an eradication strategy. So until we're getting days of zero, that there won't be an end of lockdown. Do you agree with that strategy?
Well, Tom, we have to look at the numbers. I mean, can the government actually say that we've got this under control? Is contact tracing working? You know, the reason we're in lockdown, the reason we went into lockdown in February was because they couldn't contact trace properly. Is that what the government is saying again, why we need to have this extensive lockdown? Because these lockdowns are causing so much damage to people's mental health, small businesses. There are health workers who are being turned away from being able to work. They're not being able to work because they haven't got been vaccinated because they can't because of health reasons. There are dozens of healthcare workers who are just despairing because they can't get vaccinated, despite what the government is saying. There is a lot of confusion and a lot of mess out there. So the government needs to be upfront. Where are we in terms of the frontline workers that have actually been vaccinated? Why? They've got to explain. The Chief Health Officer hasn't actually explained to us why we are in this current lockdown and how long it'll be extended for, if it will be extended for. They're the questions that the government needs to provide to Victorians, because there is no JobKeeper this time. And there are businesses and their staff who are not getting paid, they're not getting an income, and it is incredibly devastating for them. The phone calls my office is getting from people is really alarming.
But we always get health advice, and then it's what to do with that advice. It's how much of a risk profile we have. If we continue to have no unknown cases and a handful of local community transmission cases, do you think that's the point at which the hard lockdown should end? Or do you think something akin to eradication is the right approach? What's your view?
Well, my view is, and as you just said, if there are no mystery cases and the government is confident in that they can contact trace and they have got these cases ring-fenced and people are in their isolation and the government is following up, then surely that is the benchmark, if you like, for the health advice to say, we've got this under control, Victorians, we can ease restrictions. Okay. But we don't know, Tom. The Chief Health Officer hasn't been providing us that advice. We're not privy to that advice, and I think Victorians deserve to understand what that actual advice is saying.
You mentioned frontline workers, the biggest concern this time and last time, aged care facilities, most of them run by the federal government. What do you make of the federal government ending this scheme whereby workers couldn't work at multiple venues? That was running until November and then scrapped. Should it have been continued?
Well, you're right. There is responsibility. The federal government has responsibility for private aged care settings. And the state has responsibility for public aged care settings. And let's not forget the disability sector here that the state has responsibility for. Very vulnerable groups. Now, in November, when it was decided, I presume, by government's National Cabinet that they had got on top of this and there was virtually no community transmission, or they were confident of that, they relaxed those requirements to work across. People do work across different sites. I understand that. I've worked in an agency setting myself as a former nurse, so I do understand that. But if there is risk that the government has identified, then that is a responsibility of both governments, and they should be working together on this. What I'm concerned about is the number of frontline workers that haven't yet been vaccinated, both within our public health setting and those very vulnerable groups like disability and aged care setting.
Again, those frontline healthcare workers, in particular in aged care, that are seemingly the biggest concern right now, they're mostly a federal government responsibility. So are you disappointed in the failure of 1A? I mean, we're getting people aged over 40 getting vaccinated now, and 1A hasn't been done. That seems a pretty clear failure from the federal government.
Well, Victoria's under a constant state of emergency, a continual state of emergency. The Chief Health Officer has the powers to mandate vaccinations. They did last year on the flu vaccination. The last order of July 2020, actually from the Chief Health Officer or Deputy Chief Health Officer, mandated that. We haven't had that. We haven't even had that in flu vaccination for aged care workers in this state, let alone COVID. So I think there is a dual responsibility here that both governments need to be looking at this. But clearly, the Labor Party, the Andrews Labor government here in Victoria has dropped the ball. They haven't planned for this outbreak. And as a result, these mandated, the basics have not been done in flu vaccinations for aged care.
Okay, but you mentioned the Andrews government.
All COVID.
The federal government hasn't even been able to offer aged care residents, all of them, a second jab, let alone all of them a first jab. That's a failure, isn't it, of the Morrison government?
Tom, I would say that this is a responsibility of both governments. I'm not saying that it's not a responsibility of federal governments, but my understanding is that from what reports I've heard, that 100% of aged care facilities have been offered the vaccination. Now, of course, residents will go in and out of aged care facilities, and I don't know the rates of the workers on that. My point is that governments must work together on this. And if we're under a continual state of emergency where it was mandated that flu vaccinations be undertaken for visitors and resident staff in aged care facilities by the Victorian government last year, why has that basic operation not been undertaken this year? They keep telling us we're still in this pandemic, and yet they have failed to plan for this and to get those aged care workers, but more importantly, those residents protected.
Out of time, but Georgie Crozier, appreciate your time today. Thank you.
Thank you, Tom.